Next, I invite Dr. Sindhu NM, Associate Professor, Government Medical College, Ernakulam, to introduce us to the Mimickers in disc edema.
Good morning to all. What are the mimickers of disc edema? The disc edema is the swelling of the optic disc. It includes all the causes of active or passive dedimatous swelling of the optic disc other than the causes of papilledema. We can notice in a case of disc edema there is hyperemia of the disc with elevated margins, disc elevation, blurred margins, nerve fiber layer swelling and tortuosity of the vessels. Whenever you get a case with a disc edema, you should look for is it true disc edema or is it not. The causes of pseudo disc edema or the mimickers of disc edema includes optic nerve head drusen, myelinated nerve fibers, morning glory syndrome, tilted disc, small hypermetropic disc, optic disc hypoplasia, and Bergmester's papillae. I'll go into each one in detail. Optic disc drusen is a highly like calcifical material deposited within the substance of optic nerve head. It is seen in 0.3% of the population. It's often bilateral, and some association include retinitis pigmentosa, angioid streak, Alagille syndrome, and complications are usually rare with optic disc drusen, but sometimes you can get CNV, central retinal vein occlusion or central retinal artery occlusion. Imaging, the fluorescent angiography shows progressive hyperfluorescence due to staining but absence of leakage. Ultrasound, most reliable method because of its ability to detect the calcific deposits that show high acoustic reflectivity. This is how the first picture shows. In fundus examination you can see the calcific depositions. This, in OCT you can see, OCT helps in delineating optic disc gluten. It is for fluorescent angiography, autofluorescence, and CT is not usually diagnostic due to the radiation, but you can coincidentally see bilateral optic disc drusens. Myelinated nerve fibers, in normal eyes, optic nerve myelination stops at the cribriform plate. Ganglion cells retain a myelin sheath. In this case, it's most often unilateral. The ocular associations include high myopia, anisometropia, and amblyopia. The systemic associations are neurofibromatosis 1 and Golin syndrome. This is a fundus picture. You can see in usual fundus examination, you can see myelinated nerve fibers are in the peripapillary area or in the posterior pole. In OCT, you can see a hyperreflective layer in them. Next is a morning glory syndrome. It's a very rare condition, usually unilateral and sporadic condition. Visual acuity may be normal. Fundus examination shows a large disc with funnel-shaped excavation surrounded by an annulus of chorioretinal disturbances. Blood vessels may emerge from the rim of the excavation in a radial pattern like the spokes of a wheel. This is a morning glory flower, and this is how the fundus shows a very large disc with excavation and vessels in a radial pattern. The systemic associations include frontonasal dysplasia, hypertelorism, flat nasal bridge, and occasionally a mild midline notch in the upper lip and a midline cleft in the soft palate. It will be associated with midline brain and malformations. It is absent corpus callosum, hypoplastic cerebellar vermis, small optic chiasm, malformed occipital lobe, and pituitary deficiency. NF2 is an association though it's less common. It can also associated with face syndrome. Tilted disc is another mimicker, common and usually seen bilaterally. It's caused by an oblique entry of the optic nerve into the globe. The signs include a small oval or D-shaped disc. The margins are indistinct where the retinal nerve fibers are elevated. The associations include inferonasal chorioretinal thinning, myopic astigmatic refractive error. In the perimetry, we can see a superotemporal defects that do not respect the vertical midline. This is how you see a congenital tilted disc fundus examination. Other mimicker is optic nerve hypoplasia. It's unilateral or bilateral, characterized by diminished number of nerve fibers, commonly involving midline structures of the brain. The predisposing factors include some agents taken by the mother during the gestational period, or like LSD, quinine, anticonvulsant, or excess alcohol intake. Superior segmental hypoplasia may be associated with maternal diabetes. It's a fundus picture showing hypoplasia. You can presentation. Bilateral cases present with blindness in the early infancy. Unilateral cases usually present with squinting. The signs, visual acuity may be normal or impaired to a variable degree, even to a no perception of light. Fundoscopy shows a double ring sign. The small gray disc surrounded by a yellow halo of hypopigmentation caused by concentric chorioretinal atrophy. The distance from the fovea to the temporal border of the optic disc often equals or exceeds 3 times of the disc diameter. Here, the retinal vessels are normal in caliber but tortuous. This is double ring sign, the yellow halo. The peripheral margin of the encircling ring corresponds to the border of the normal sized optic disc. Other features include astigmatism, field defects, dyschromatopsia, afferent pupillary defect and foveal hypoplasia, aniridia, microphthalmos, strabismus and nystagmus. The systemic association shows wide variety of midline developmental brain defects, most common Demorsius syndrome, characterized by absence of septum pellucidum, agenesis of corpus callosum or hypopituitarism. Bilateral optic nerve hypoplasia may be a marker of potential endocrine dysfunction. The last one is a Burgmeister's papillae. It is a remnant of the fetal hyaloid artery that can be seen on ophthalmoscopy or OCT. It is an asymptomatic and benign. Thank you all for it.
Thank you, Dr. Sindhu, for that concise description.